We are live, sir. Start कीजिए.
Okay, sir. Sorry, once again, welcome, sir, to all delegates.
Thank you.
Good evening to all delegates. And today our speaker is Dr. Rituraj from Hajipur. He is very big physician at Hajipur, and he will speak something about our rabies 3-dose anti-rabies vaccine. So, welcome to sir, and hand over the session to Rituraj, sir.
Thank you, all of you. And today I'll be talking about novel 3-dose G protein vaccine, ultimate key for compliance. So we all know that previously rabies vaccine, we already faced a lot of problem in compliance. So we'll be talking on that topic. Rabies, we know that this is a public health challenge in India. Globally, there is 59,000 deaths annually, which is highest in India. And India had around 20,000 human deaths from rabies, accounting for 60% of rabies deaths in Asia and 35% globally. 91% death occurs in rural area. So this is the key concern here. So we all know the current management on rabies. We have local wound treatment, active immunization, and passive immunization. So previously we had rabies post exposure prophylaxis. We had 5 doses, which was given intramuscular in cat 3 exposure. So the current challenges for post-exposure prophylaxis is non-compliance, and second one is current rabies vaccines are cell culture vaccines. So the newer vaccines which we're talking, which are different. So inactivated vaccines are 15-year-old technology. So those
Sir,
are inconsistent in
sorry, sir,
potency, stability.
सर ये प्रशांत तुम ये सर का स्क्रीन शेयर कर दो ना, जो वो है स्क्रिप्ट. हेलो प्रशांत. प्रशांत. हेलो. प्रशांत हेलो. हेलो
सर ज्वाइनिंग हो रहे होते.
हेलो
Yeah.
प्रशांत.
So coming to the compliance, anti-rabies vaccine, compliant are the patient who took the full course of ARV. Delayed compliance are those patients which completed the ARV within 60 days, but deviated from the scheduled regimen, and dropout are those which have taken 1 dose or not completed all the dose. So coming to the non-compliance to 5 doses, proven cause of death. So what are the there are 3 patients here we can look, and there is one patient, 58 years female, having a street dog bite, which she was killed soon. Post-exposure 3 doses was given, purified chicken vaccine, no rabies hemoglobin was given, and the chronology of events was like course of dog bite category 3 at the right side of the nose, 20 days paresthesia of face, fever, restlessness. CSF findings show cell count 5 and monomorph 100%, protein 126, sugar 71. So diagnosis was considered as rabies encephalitis. Confirmatory test was given as rising serum and CSF virus neutralizing antibody titer was 1:8192 and 1:2048. MRI findings show bilateral brainstem mild hyper intensity without any restricted diffusion. So treatment modified Milwaukee protocol was followed, and outcome was patient died after 16 days survival. and she took Lama. Next patient we see here, the 38 years male, which had a street dog bite. Status was unknown. 3 doses was given. Dog bite category 3 was there, and left mild calf bite was there, and dysphagia, restlessness. She also took Lama and died. So again, we see here 34-year male, dog bite was there, and 3 doses was given, and the category 3 at the right dorsum foot, 70 days, dysphagia, restlessness, total cell count 60, rabies encephalitis were diagnosed in all three, but they died. So compliance to post-exposure prophylaxis among animal bite, a hospital-based epidemiological study was done at Safdarjung, New Delhi. Total number of patients was 360. A pre-designed, pre-tested structure questionnaire was administered by the interview technique. 53 were non-compliant to the full course of ARV. So compliance for anti-rabies vaccination in post-exposure prophylaxis, you see at Municipal Corporation Hospital, Bangalore, 215 patient was taken. 1 dose of rabies administered intramuscularly on day 0, 3, 7, 14, and 20 as post-exposure prophylaxis, and compliance to the completed course was completed. 28 days, we can see the compliance was only 60%. Constraint from compliant to complete course of anti-rabies, we see always compliance is not here, was restricted because of many reasons. So first we see here interference with school timing, distance to the hospital, cost, forgotten days, and low cost wage. So what are the evaluation of rabies vaccine? We see that like before there was live attenuated vaccine, then later on 1911 there was inactivated vaccine, and then 1976 cell culture vaccine, which all are non-compliant to lead evaluation of treatment regime from 31 days to 5 days and still on. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen. So novel three dose recombinant rabies G protein vaccine. First, we see that first protein subunit vaccine. It is the first unit protein subunit vaccine. First, then it was prepared by VLP platform technology. First vaccine with 3 dose intramuscular regimen, and it has a better compliance and convenience and better compliance and convenience. So coming to VLP technology, so the VLP technology, G protein is difficult to stabilize. G protein isolation using VLP technology was purified and stabilized by Kerala Pharmaceutical. And virus-like protein complex exists as nanoparticle. We all know VLP are similar to native virus particle, but they do not contain viral genome. They can they cannot replicate, but can mimic the viral antigenicity without being pathogenic. They are capable of inducing a strong humoral and cellular immune response. So VLP as a vaccine was used. Coming to clinical study phase 3, safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as stimulated post-exposure immunization, a randomized comparator controlled and multi-center phase 3 study was done. So to evaluate immunogenicity and safety of rabies G protein administered as stimulated post-exposure immunization in healthy volunteers. Randomized comparative control multicenter study on 800 subjects, 530 subjects TH rabies, 267 for Rabipure. And the results were compare as results were compared on efficacy and safety. So efficacy, we see here seroprotection for TH rabies was 99.24% compared to 97.72% for the other reference. So the results were consistent across different age and group and gender, and observed difference was 1.52%. Non-inferiority of for protection, primary endpoint day 14 and 42 were met. Test and comparator are identical in seroprotection rate both on days 14 and 62. So coming to efficacy, we see that seroprotection is similar, better than previous. Safety, we see that local adverse effect and systemic adverse effect. We see in the chart here that TH rabies have performed better in local adverse effect and systemic adverse effect both. So we can see here in this chart. Study conclusion: novel 3
प्रशांत, नेटवर्क इशू है क्या?
थोड़ा सा है सर।
हम्म।
स्लाइड हो गया है सर?
हाँ, लाइव है, लाइव है।
स्लाइड हो गया ना?
कुछ बोल रहे हैं क्या? हाँ खोलिए।
सर टोटल पार्टिसिपेंट 150 के आसपास हैं ऋतुराज सर।
हाँ हाँ
और सर एक उसमें क्वेश्चन आंसर का था सर, वो
सर।
शांत।
हाँ सर, है सर वो।
शांत,
हाँ है सर, वो है सर।
तुम्हारी आवाज नहीं आ रही है।
क्वेश्चन आंसर है, हाँ।
प्रशांत।
जी सर।
हाँ हाँ क्वेश्चन।
हेलो
सो
सर, कनेक्टिविटी है सर?
प्रशांत, मेरी आवाज आ रही है?
जी सर।
हेलो। हाँ प्रशांत।
जी सर।
हाँ आ रही है आवाज।
हाँ सर, कनेक्टेड।
हाँ हाँ
अच्छा, एक बार पूछ लीजिए।
Yeah, any question you have, audience?
सर कोई क्वेरी आया है सर?
नहीं नहीं, कोई क्वेरी नहीं आया, केवल सर का पास जो 2 क्वेश्चन आंसर है ना,
हाँ,
उसको सर थोड़ा सा ये कर दीजिए।
अच्छा ठीक है,
इलेबोरेट करना है उसको।
ठीक है,
हाँ
ठीक है.
हाँ
So what is rabies and how is rabies transmitted? So rabies is a preventable viral disease. We all know rabies virus infect the central nervous system and cause disease in the brain. Rabies is 100% fatal disease and there is no effective treatment for rabies. Rabies virus is primarily transmitted from rabid animal saliva when it bites or scratches someone, leaks to wound or graze or broken skin or to the lining of mouth or nose. Mouth and nose can also transmit the disease. Dogs are responsible for 96% of human rabies cases. And the question comes how one treat if a dog bite happens. So if a person is bitten by an animal, wound should be washed and flushed immediately with soap and water for 10 to 15 minutes. If soap is not available, flush with water alone. This is the most effective first aid against rabies. Second is wound should be cleaned thoroughly with 70% alcohol or ethanol or povidone iron if available. As soon as possible, take the person to the healthcare facility for anti-rabies vaccine. And what are the limitations for anti-rabies vaccination dose and benefit of novel 3-dose vaccine? So the complete post-exposure prophylaxis is necessary to prevent rabies among all animal bite victims. It is essential for the bite victim to complete the full course of vaccination as recommended for complete protection. The compliance to anti-rabies vaccination for post-exposure prophylaxis is only 60% is cause of concern. As animal bite victims who do not complete the full course of vaccination are still at risk of developing rabies. The novel 3 days recommended rabies G protein vaccine taken on 037 days was found to be safe and immunogenic and was comparable to 5 doses of WHO qualified vaccine in simulated post-exposure prophylaxis. The reduced number of vaccine doses lead to reduction in number of visits and travel cost as well as increase the compliance, which is important to prevent rabies and ultimately help in eliminating dog-mediated rabies by 2030.
ओके सर, कंप्लीटेड।
यस
Complete.
सर।
ओके सर, तो once again thank you to Dr. Rituraj sir for the informative talk, and also thanks to all delegates who have joined this webinar, and we
Thank
truly appreciate your effort, Dr. Rituraj sir. Last but not the least, we would like to inform you that Travis has won 2 prestigious awards in innovation category: ET India Pharma Award and Golden Globe Tiger Award.
Nice to
So
hear. Nice.
I request to all my participants, please where you have need anti-rabies vaccine, please recommend our Travis 3-dose
Surely.
anti-rabies vaccine, world first 3 dose, and 037 its dose. So thanks to all of you. Thank you, and thanks to Rituraj sir. Thank you, sir.
Thank you.
Can we log out now?